Hello, Colin Hung here for Healthcare IT Today. Over the past few days, we have been here at the NextGen User Conference in Nashville, Tennessee. The NextGen team was kind enough to invite us down to cover their event. The company gave us a free media registration, but we paid for everything else. NextGen is a sponsor of Healthcare Scene, but this video is not paid for. I was very excited to sit down with our next guest. We don't often get a chance to speak to someone who is working in an area of healthcare that doesn't get enough attention: Indian or Indigenous health. Not only was I curious to learn more about how they are leveraging NextGen's technology, I also wanted to get their reaction to the recent announcement that traditional medicine has been approved by CMS for the first time. Joining me on the program is Angie Wilson, Tribal Health Director at the Reno Sparks Health Center. Let's get to it. Angie, welcome to the program.
Thank you.
I'm very excited to talk with you because we don't have an opportunity to talk with folks who are dealing with the area and the patient population that you are. So maybe to start, if you can give us a little bit of the background of your role and your organization and who you serve, that would be fantastic.
Sure. Well, my name is Angie Wilson, and I'm the Executive Director for the Reno Sparks Tribal Health Center. We serve approximately 6,000 American Indians and Alaska Natives living in northern Nevada in the Washoe County area. But we have folks coming all the way from California on over to our services. So we're very happy to be a part of the Reno Sparks Indian Colony, which is a local tribal government in our particular area.
And what kind of services do you provide to the folks in your catchment area?
Sure, we have a full medical clinic. We have a pharmacy, behavioral health. We have non-traditional transportation. We do community public health. We do optometry, dental, and a full referrals program. We have a gym. We have a really special diabetes program. We have registered dietitians, everything from chiropractic care, you name it. So we do a lot of primary health care and then prevention activities. Yeah.
Now, Angie, some big announcements happened recently with regards to Indigenous care and Indian care. Can you give us a preview about that before we dive into some of the technology you're using?
Sure. Yeah, very happy to. It's a very exciting time for us here in the United States and Indian country. I sit on the CMS Tribal Technical Advisory Group, and we're really excited to hear the news that the Centers for Medicare and Medicaid Services have approved traditional medicine for 4 particular states: Arizona, California, Oregon, and New Mexico. So this is really groundbreaking, very historic time for us. Very excited to see what's going to come of that demonstration waiver and the implementation of traditional medicine within a Western medicine programs.
Will that mean that folks who are coming in to see you will be able to have both styles
Yes.
of treatment and medicine? And
Yes, the beauty is that it's not only the Western medicine model, but being able to incorporate cultural values and practices in traditional ways into the primary care practice as well. So people could get integrated with healthcare as they see it, as they see fit for themselves, in ways that we are able to also use it for prevention and intervention activities and to support things like treatment or outpatient care. So we're very, very excited for that. It's a very exciting and historic time.
well, and I think also, yes, there's a care aspect of it, but there's also the access, right? Where people may not have been, let's say, very willing to come in, may now go, hey, well, if there's some medicine that I'm used to or that is more culturally appropriate for me, maybe now I'm more willing to come in, whereas before they might not have been as comfortable.
Yeah, I think that it does a multi things. We have multi-generational families. And so, with everything from our elders who have, been part of those practices to our new generations that want to get incorporated into cultural practices, I think the beauty is that the access is there and the return back to cultural and traditional values in our tribal communities is so vast and so critically important in our overall health and wellness. So I think just that concept is so beautiful in its own sense. And so I think that tribes across this nation are so excited for what that's actually going to be able to look like. Yeah, so very excited for that.
I'm excited for you.
Yeah.
Now, Angie, we are here at the NextGen User Conference, and I take that to mean you've been on NextGen for a little while. Can you tell us how you're using NextGen in your practices?
Sure. Yes, we transitioned to NextGen in about 2015. NextGen is, I always love to say, it's like the central nervous system of our healthcare delivery system. So it reaches every single impact of what we do. But we use the NextGen system, the electronic health record. We just transitioned over to what is the use of AI and charting with the ambient program, which has been significantly beneficial for our clinicians to help clinician burnout, to streamline the care that we give. It really operates by giving more face-to-face time with our providers and our patients, which is critical in a tribal community. I think it just warrants that good, warm care. So that's been really useful. We're also utilizing population health, which is phenomenal. Population health gives me all the tools that I need as a tribal health administrator to look at the decisions I make and how to drive the clinics forward, what it looks like for revenue, what it looks like for pre-visit planning, to make sure that we're reaching out to folks that may not have completed their, preventative measures to be able to close the gaps on that. So population health has been so critical in our success. Recently, we've had fires in our local community, and we had an entire population that was evacuated. And the beautiful thing here is that population health analytics has a geospatial data that we were able to plug in the zip codes and be able to get our patient list of everybody that was evacuated literally in seconds. So being able to do targeted outreach to them in an emergency situation was phenomenal. So being able to incorporate all those things for us to do outreach to our patients, I think the overwhelming feeling from those patients, we had over 200 that were evacuated, has been remarkable in the feeling that their tribal health center was there to support them during that effort. So it's really remarkable stuff.
That is probably one of the more unique uses of an EHR that I've heard. You're actually using it to help manage an evacuation that happened. And as you said, I'm sure the patients felt very taken care of, that you were able to reach them after they've been put somewhere else.
Yes, it was pretty remarkable. We're still hearing the comments on it. And we do a lot of collaborative effort with the local state emergency services. I think they were also extremely impressed that we had those capabilities. All in all, though, the NextGen system is pretty profound. We've been able to double revenue in less than 2 years by really looking at our clinical workflows, our clinical support workflows, and making sure that we're engaging patients for active encounters, to really kind of close the gap on those types of things. So we're really proud of the system and really proud of the work that we put in to really showcase it and have it be what we need it to be to meet our overall goals in the community.
If you don't mind me asking, Angie, what kind of outreach are you doing to your patients? Is it via text? Is it by email? Is it a combination of all of those things?
It's a combination of it all, including even the utilization of our social media. Social media, phone calls, text messages, emails. I mean, we use every different aspect that we can to kind of design the programs for outreach. And then we've also incorporated some of the data on risk factors into a new system that we're using in the clinic to show risk factors of our particular patient populations. So it sparks the inquiry of, we have a risk factor that shows what is your likelihood of having a cardiac event in the next 10 years. And in some of the cases, it's extremely high. So being able to use that tool to say, do you know where you're at on this scale? If not, make an appointment with your provider and find out. And not just doing those types of things are pretty remarkable. And then pushing that out to our social media campaigns as much as we can without, violating, protected health information. But I think it's been such an incredible tool that is really start to use education and those types of things to really help our patient population.
Well, Angie, you've shared a ton of great information with us today. Where can people go to learn more about your practices?
Sure, you could go to our clinic's website, which is rstic.org, and learn more about us.
So, Angie, thank you so much for taking the time and coming on our program today.
Thank you so much for having me. Laheli Chichka, thank you so much.
Wow. I really enjoyed that conversation with Angie. It is so encouraging to hear that the community they serve will soon be able to receive culturally appropriate care, which will hopefully encourage more people to get the care they need and maybe improve outcomes too. Now, if you enjoyed this interview, please mash that like button and click subscribe. Also, head on over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung here in Nashville, Tennessee. Thanks for being here, and I'll catch you on the next video.